All right. I think just in the interest of time, we have quite a lot to go through, so we'll probably just go ahead and start. And I would like to thank you all for joining today's capacity sharing workshop. We've titled this Impact Documentation for Civil Society Organizations Promoting Health Equity Across Africa. Before we begin, I would like to acknowledge the traditional custodians of the land. I am calling from the Wajik people of the Nunga Nation. I pay my respects to elders past, present, and emerging, and extend a warm welcome to all tribes, cultures, and communities that are represented here today, and of course, people who will join us later or watch the recording. My name is Yakubu. I'm a research fellow at the George Institute for Global Health. The George Institute is an independent research organization. We have offices in India, the UK, China, and Australia. We partner with communities globally to conduct high quality research that tackles major barriers to health. And through the George Institute's Ubuntu Initiative, there is a commitment to build meaningful, equitable partnerships with African researchers, institutions, and communities. And I would like to invite you to take a moment to introduce yourself in the chat. I wish we could take turns and do it together, but I know that will take a bit of our time. But if you could just write in the chat and let us know where you're calling from, your country or city, the organization that you work with, and tell us a bit about your role. So my background is in research. I do research, but I'm always fascinated when I get to interact with people from grassroots organizations or civil society organizations, people who advocate for other groups or social entrepreneurs. So tell us a bit about your role in the chat. And please keep an eye on the chat. We will be using the chat, throughout the workshop to just keep things interactive. And sometimes there are a few things that we will share, maybe like resources from our facilitator and from our organization. So a little bit about why we thought this workshop is, or why we think this workshop is necessary. It really grew out of conversations that, we were having earlier in the year when we visited Kigali for the Non-Communicable Diseases Alliance Forum and then the Africa Health International Conference that, sort of followed each other. And in our interactions with people who work in civil society, we were reminded of the critical role they play, not just in advancing health equity, but in actually supporting health service delivery and actually driving social change. And often this is happening long before funders have come and left the country, and they still build those relationships and continue. So we were really inspired by the commitments that many of these community-based organizations have to their communities. And even in the light of dwindling international development, civil society organizations still remain very committed to their populations. Some of the things that we were hearing when we interacted with these community-based organizations is the need to be more visible, the need for recognition, the need for support, and the recognition that impact stories are key to helping civil society organizations stay, sustainable and visible. So we agree with a lot of what you have shared with us. And we agree that sharing impact is not just about reporting an event on social media. It's really about helping others understand your value and the change that you drive in your communities. And when people don't understand that, they don't know how to support you. So we think that, this issue of recognizing where you've made impact, documenting it, sharing it, we think it's really key to the sustainability plan of civil society organizations. And so the way we have structured today's session, we've structured it into two parts. It's going to run for 90 minutes. The first part, we will be trying to understand what impact means from your perspective, in whatever role or capacity that you work in. And we will share experiences, There will be, sharing about practical tools that organizations have found helpful, especially, civil society organizations, to recognize that they are making impact, document it and share it. And then the second part is really about amplifying impact through collaboration. And in that section, what we'll be doing is reflecting on how civil society organizations and research institutions can work together. And so we'll be inviting, people to share their experiences as well. In all of this, what we're thinking is that researchers can learn from civil society organizations when it comes to impact, and we believe there are ways that we can support and strengthen each other's work. So with that, I'm really delighted to introduce our workshop facilitators. The first session will be led by Rabia Khan. So Rabia is a public health researcher, a data storyteller with 25 years of experience working across the world. She's currently based in Sydney, Australia, where she supports purpose-driven organizations to use data and storytelling to drive social change. She specializes in ethical, community-centered approaches to capturing and communicating impact. Her focus really is on promoting equity, dignity, and practical action. And she has worked with governments, non-governmental organizations, and grassroots organizations to strengthen impact measurement in ways that honor and strengthen community voices. Her work bridges the gap between numbers, statistics, which some of us maybe like or don't like, and narratives, and constantly, whether she's doing the number crunching or she's doing stories, her focus remains on equity, dignity of individuals and of people, and action. So not just staying in the theoretical. So we're really delighted to have Rabia. Rabia, welcome. And Deepika Saluja is our second facilitator. Deepika holds a PhD in public health policy from the IIM Ahmedabad, India. My apologies, Deepika, I'm not doing a good work on that. So Deepika's background is interdisciplinary, science, management, policy degrees, and her interest centers around women's health across the life course, and she's worked for over a decade in consulting, research, and implementation. And her work really lies at the intersection of, gender rights and health. So at the George Institute, Deepika works from our India office, and she is a thought leader advisor within the impact and engagement team. And her second role is as program manager for the Ubuntu Initiative at the George Institute. The Ubuntu Initiative is actually a strategic initiative within the George focused on building equitable partnerships across Africa. And we do that by, strengthening research partnerships, doing a lot around capacity strengthening, and really looking for more ways to drive impact and engagement. So it's really a delight to have both Deepika and Rabia as our facilitators. And I'll be coming back later on, to really help a bit with, the feedback session. I think with that, I'm going to hand over to Rabia.
Thanks, Yakubu. No, thanks for that great introduction and also just setting the context on where and why we are here. I think that's always useful for everyone to kind of recap where this idea came from and why the George Institute is involved. So firstly, thank you for everyone who's made it. So on this session, the first session, which is on ethical impact storytelling for change. And it's really exciting that we've got quite a few, I can see a few faces and names now popping up. These change makers from across Africa who are already doing incredible work in communities. So this session is really interactive. I do like warning people in case they're driving or they're walking kind of thing, that it's an interactive session. So we either have your phones out if you're a Mentimeter person, or you can have the have another web page open. So warning, that's interactive. And what we're going to be exploring in this first segment, the next wee while, is how can we tell the story of your work, of our work, in ways that are ethical, powerful, and deeply respectful of the communities we serve. So I kind of going to do three bits. The first bit is we're looking at language when we use in impact stories and how it shapes perceptions. Then we're going to explore what impact really means and how do we move from reporting activities to documenting meaningful change. And then I'm going to finish off with a little fun visioning exercise in terms of how you would want your stories to be told in the future. So we're going to kick off with something interactive. Thanks, Deepika. And this is, we are playing a quick round of impact language bingo. So I'm going to read out these words, and these words, they often show up in our work, in mission statements, in proposals, reports, social media posts, when we talk about impact, when we ask for funding. So if you hear a word that you've recently either in your own organization or someone else's organization seen it in a mission statement, proposal, report, evaluation, or impact, mentally mark it. And if you get three words in a row, either across, down, or kind of across or down. So three words across or down, just type bingo in the chat. Or you can come off mute and yell bingo kind of thing. So we are a smaller group, so we can, I was going to say, feel free to raise your hand if you've got questions and interrupt me. I'm fine with that. So let's start. Ready? Here we go. Empower. Victims, needy, vulnerable, voiceless, hard to reach, combat, tackle, save, support, destitute, beneficiaries. Any bingos? No, not a single bingo. No one got three in a row. Did anybody get three words at least? Bingo. Okay, thanks, Rita. Yes, we finally got a bingo. Okay.
Yeah, I might not be able to type very well, clearly.
Yeah, that's yeah.
It's too early where we are, but yeah.
Okay.
Yeah, empower vulnerable combat for sure.
Yeah. Thanks, Shweta. You got another bingo. Oh, you got a couple of bingos. You got two more bingos. And now thanks for playing along, and thank you for being honest. And the important part here is this isn't about blame. The truth is these words are everywhere, and these words aren't inherently bad. And I want to be clear, words like empower, hard to reach, voiceless, they're not bad words. They can be meaningful because they do reflect real inequities. But they can also quietly position communities as broken, passive, waiting for rescue. And that framing shapes how the world sees them, but also how we define impact. And many of us were taught, myself included, that this is how we show urgency or justify funding. I have used every one of those words in my career, kind of thing. So I am guilty just as much. But when these words are the only words and the only words that dominate, they frame communities primarily by what they lack and not by what they have. And they position people as passive recipients of change rather than active participants in their own progress. And that framing influences how the world sees them, how we define, measure, and report impact. Because too often, impact reporting focuses on what's missing or just counts what was done. And these narratives have consequences because they shape how outsiders, how funders, and partners perceive communities, how they prioritize resources, and also how they evaluate impact. And at times, they can strip away, and a lot of times, dignity, agency, and the reality of community-led change. But deep down, what funders, communities, and partners really want to know, what's changed for the better. So today in this next bit, we're going to explore how do we shift from this deficit-based impact storytelling to a strength-based impact storytelling. Thanks, Deepika. So ethical impact storytelling means telling the truth about the challenges. So I'm not saying don't talk about challenges, but you're still preserving dignity, agency, and reality of community-led change. And so let's look at an example. And this is a very common way of reporting impact, and then a way of reframing it. So we always look at, we supported 100 unemployed youth. I think it didn't take me much to find these statements. Most of these statements, I just kind of scrolled through LinkedIn and found them. And what this is, it tells us the scale of the problem and who it was for, but not what the difference it made. So it's keeping the focus on the problem, unemployment, and the activity support. Now, the second one, which is an asset-based reporting example, within 6 months, 65% of participants secured jobs or started their own business. So now we are hearing the outcome, the positive change experienced by the youth. And so this kind of framing, just flipping it, it gives credit to the capabilities of the people you're working with. They're just not recipients of help, they're actors in their own transformation. And that's the real impact. That's the change that sticks with people and communities after the program ends. Next slide, which I think is the Menti one. Okay, so this is when we get to interact. So either if you've got your phone with you, if you can use the camera to do the QR code, or go to www.menti.com and enter the code 66976553. And that should get you to, so you can use your camera, and I think Deepika, you might, yeah. So where does this deficit pressure comes from most in your work? I'm interested to hear, why do you use this language? So we've been talking about deficit and then into benefit. Where is the language coming from? We're getting a few. While we're waiting for people's things, anybody wants to kind of throw in, I think it might take a while, and a comment. Where do they think this language is coming from, the pressure to use this language? Yakubu, go ahead.
Thanks, Rabia. I remember writing on a grant and working with a few colleagues, and the framing was so deficit focused. And what I was told was that, see, you've got to show the problem. And when you get the money, you can now write it the way you want to write it. And so I see a bit of influence on the way I write the grants gets me the money. And then whatever I do after that, it's different.
No, thanks for sharing, Yakubu. And I think a lot of it is that. It is how our funder templates are. And a lot of it is also, I think, in the global health space, driven by Global North organizations in terms of that kind of expectations that if you want funding, you need to show a greater need and use these terms. And I think one of the things is in a way, we also have to start teaching our funders. So we still use those words, but maybe also have something that is a bit more paragraphs of asset-based or strength-based reporting. Because yes, these are words that gets us money, but buzzwords that need to be incorporated. So I think it's about how do we kind of shift it? So we have not only we shift, but the funders also have to shift, I think. And I think I don't think it will happen overnight, but I think it is a useful way to think it through. And sometimes it becomes so ingrained that you write it to get the funds, but you also use it to write your impact reports, because it's ingrained in the language we use, kind of thing. Think we can think pretty much everybody. So, okay, so we've got internal habits, funder templates, media comms expectations, And so excellent. So I think we can go two. I think it's running pretty steady. Ooh. Yep. And next slide. So it's quite interesting to kind of think about why we use this language, and hence that Mentimeter thing, to kind of think in terms of why do we use this language. And when we talk about impact, we want to kind of think that the storytelling isn't just a communication tool, but it's also a responsibility. And sorry, I've just noticed the chat box. I think I've got way too many things happening. Apologies, kind of thing. All of a sudden things are popping up everywhere. Kind of stuff. Apologies. So I think it's the way we tell stories reflect our values and shapes how others understand our work. And some of the principles I keep coming back to. And look, it's taken me 25 years to get here, kind of thing, and I don't have all the answers. It's just a way of some principles to rely on. And one of the ways, and mostly more in impact, on the impact side of things, the impact reporting side of things, is my first principle is I center community agency. It's about centering community agency and not organizational heroics. So what does that mean? So it means is too often we frame our impact story, we came in and we fixed things, kind of thing. And real impact happens when people and communities have the power to make their own change. Our role is important, but we are not the main character. We are not the hero of the story. We are a background character, kind of thing. So we are not the main character like in a movie things. We're the background character. And so I think that's what we need to think of when we do our impact reports. We need to center the voice, the actions and agencies of the people we are working with, but telling the story with them, not about them. The second one, and this is the one I'm still working on and still kind of, it's one of them that's really complex, is how do we hold need and strength together? And I think it's something what you just said, Yakubu, about writing it and how do you get the funds? If you don't show need, you don't get funds. And we sometimes slip into this either or thinking, that either we focus on the needs so that we get the funds, or we only talk about strengths and maybe not get the funds, or maybe it's in terms of impact storytelling. We need to get smarter in how do we hold both. We don't deny the challenges, but we don't define people by those challenges. So a strength-based approach shows dignity, resilience, and the potential for change, even in the difficult contexts. So like one of the examples I would say is if like the word, a lot of people use the word vulnerable kind of thing. And I think instead of using the word vulnerable, I'm seeing a few nods. I've used it too. So this is basically my mistakes as well. Use the word vulnerable. And instead of saying this vulnerable group, I think sometimes it's despite these challenges, and name the challenges, but name the structural challenges, the community still manages to do X, Y, and Z, but they have these challenges. So they're not defined by those challenges. They're not vulnerable themselves. It's the fact that they are facing these challenges which may not be present in other communities, kind of thing. So it's kind of thinking about how do we hold the need and the strength together. And the third thing is about showing what's changed, not just what's done. So activity is not the same as impact. Running a training, holding an event, publishing a report, these are the things we do. Ethical storytelling is about the difference what we do has made. What's different now for the community? What's better? And that's what really people, and I've worked as a funder and I've worked with funders, partners and communities really want to hear. They want to tick the box that you did hold the event, publish a report, running a training, but what they fund for is what's changed, what's different. So I think we've got another Mentimeter one coming up. So okay, we go. So I should have said, don't close your Menti pages. So we've got 4 statements here, and it's just a way to kind of test what we've just been working on. Which of these statements uses asset-based framing? Is it we rescue vulnerable children from unsafe environments? We partner with young leaders to create safer spaces in their communities. We provide basic supplies to needy families. We fight poverty in disadvantaged neighborhoods. By the way, all four are real statements that I didn't take me that long to find them, kind of thing. Yeah, I think this one I did make it like and it's quite so we've got 4 responses to we partner with young leaders to create safer spaces in their communities. Oh, 5. Why do we think that's the best one? You can put it in the chat. It's a small enough group. You can come off you can come off mute. Why do we think we partner with young leaders to create safer spaces in their communities is asset-based storytelling?
Rabbi, I can say
Yeah.
something while others
Yeah.
share as well.
Mm.
I think that there's really a recognition here of the agency of the people in the community, recognizing them as leaders, number one, and the fact that it is their communities, and that we are just coming alongside them. Yeah, those are the things I can think of, but I wonder what others think.
Thanks, Yakubu. Just see what others. Sorry. I think Dozy says the people are directly involved as partners. Yeah, thanks, Dozy. Yeah, I think it makes a big difference, and I think, and it doesn't. You don't have to do that much, kind of thing, with the language. It's a way to kind of think is how do we flip the narrative? How do we ensure that the people are directly involved, shows agency? We are just there. We are not the main character, kind of thing. With the other ones, we are the hero of the story rather than the people, the community we are working with. I think we can go back to the main slide. Thanks, Deepika. So far we've been talking about the language. As I said, we were going to start with language and how we use it in impact stories and how it shapes perceptions. And all of you have signed up for this workshop because it's got the word documenting impact kind of thing. This is why we're here. I'm going to start off with curious to hear what we can go to the next slide. We're just going to do a quick Mentimeter word cloud in terms of just thinking in your head by the time while we wait for it to flip over to Mentimeter is what do you understand by the word impact? What does that word mean to you? When you hear the word impact, when you signed up for this workshop on impact, what do you understand? What are words that come to mind? Okay, we are getting a few. Yeah, I can see. We're getting a few words, change, yeah, influence, improvements. Pragmatic, policy shift, activity, positive difference, better life. Yeah. Sustainability. It's great to see this. There's a lot of more outcomes of results, measurable change, Is everybody? Because it means a lot of different things, the word impact. And sometimes it feels like it's a new buzzword in the last 5 to 10 years. It has that what used to be just called monitoring and evaluation when I first started decades ago is now nobody talks about monitoring and evaluation anymore. Everybody talks about impact. I think we can go to the next slide for the Mentimeter, because then at the second question, what's the most important reason for capturing the impact of your work? So is it to meet funder reporting requirements, to strengthen funding applications, to advocate for policy or system change, to improve services and programs, to showcase community achievements? Or if you've got an other, just type in the chat what the other is. Okay, we've got 2 people who've been really quick. And these are the common reasons of capturing impact generally. So it could be, so we've got to meet funder reporting requirements, strengthen funding applications, advocate for policy or system change. That's winning, advocating for policy or system change. There are no right or wrong answers, kind of thing. Improving services and programs, and to showcase community achievements. If anyone's got another reason for why capturing the impact of your work is important, just put it in the chat box. Okay, now advocating for policy system change still. Okay. I think pretty much everyone. Okay. Improve service delivery. Thank you. Yep. That's great to see. I'm actually quite heartened. When I've asked this question in some other settings, sometimes people just go to meet funder reporting requirements where 30 people take that one and nobody fills out the other bit. So you kind of like, ooh, kind of thing. So it's quite heartening to see in this group, we've got a range. It makes life much easier because, and I think that's where, and it's great, and that's where the power of impact reporting is that we are moving beyond that tick box activity of meeting funder reporting requirements and thinking in terms of, and the clear main reason is to advocate for policy or system change. So that is actually very heartening for that it's being used for beyond just as a tick box activity. Deepika, if you could go back to the main slides, that would be great. And I think next slide. So now thinking about that, let's do a quick example here in terms of, because people always say, oh, we don't get funding because of funders. And we've got 2 options here. Which would you fund? And you can put in the chat box A or B. Option A, H2O. I've made up, I know this social enterprise, but I've changed their names. And this is what they started with. H2O has developed a low-cost, low-maintenance, slow sand water filter technology that utilizes containers filled with sand and water. Each 55-gallon drum filter can process 200 liters of water each day. Would you fund option A, or would you fund option B? H2O has started providing clean drinking water for 400 children and teachers at one school with their technology. Since installing their filter, there has been a 20% decrease in absenteeism due to less diarrheal disease. Who would you fund? Okay, I can see the answers now. Option B, option B, option B. There's one option A. Okay, the people who voted option B, why did you vote option B? And the people who voted option A, why did you vote for option A? Neither are wrong, but it's more in terms of which one would you fund. So who wants to go? Jakub, option B shows a clear change. Option B, because it's greater impact. And option A.
Hello, can I talk?
Yes, go ahead.
Okay, my name is Dozie Akwarando from Nest of Hope, Nigeria. I think my option is B. I will rather fund B. One, it's outside the technology that is being used, which is really a good thing. But I'm going to look at the impact as the decreasing in number of absenteeism. Then that means that you are, since it's you're solving a problem by removing people from the street or something like that, then you're solving another problem by reducing diarrhea. So I think it's solving more. This is option B will solve more problem than option A. That's why I will go for B. Thank you.
Thank you. No, that's a great answer. And as I said, this is a real group of people I was helping with, because they were, and I think I'm just reading it. Sorry, I'm just reading the answers. B tells me my funding will make a difference to people's lives. In A, the focus is on technology, technical aspects, no information on how it will be used, who will benefit, if at all. Option B, because it shows impact. Option A is not showing any impact or results of the innovation, while B has shown results with data like percentages. Option A, because it involves use of low-cost, readily available materials, rather than option B, which may be dependent on the technology itself. Option A, this will lead to option B, and it is sustainable. Eventually, the community can continue using the technology to provide clean water past the end of the project. Option B, with the end of funding, the community government may not be able to continue. Thank you. Thank you for taking part. And yet, it was the same technology for both options. It was the same group of people. It just so happened when we changed from option A to option B, they actually got the funding kind of thing. The first time round, I think they didn't get the funding, and because I think they also had a very big diagram of what the technology looked like, and I think their funders really couldn't understand. I think someone in the chat mentioned couldn't understand who would benefit. And I think for them, because they were engineers, they thought it was really obvious. I mean, I had to have a very long conversation with them because I wasn't really sure what it meant either, and what they had already trialed, kind of thing. Option B, because it seems to solve multiple issues. The 20% reduction will lead to improved service delivery, and people will have quality of health. Thank you, Patience and Henry. So next slide, please. So what was the difference? So we know why we liked one and why we didn't like the other. And this is what I think one of the key things about impact reporting is benefits versus features. And a lot of times we, like our H2O water people, we get kind of stuck in what we do or what we did. So we kind of talk about the activities, the outputs, or the services we have delivered as part of as an organization. So it could be something like train 200 community health workers, because that's what we do. And that is the features of an impact reporting. But what we want to kind of flip to is the benefits. What has changed? So what's the positive change outcome or the difference these activities created? So you would change this into focusing on what's changed is 200 trained health workers now deliver regular care to 20,000 residents in remote areas. And you can see what that slight shift does. And if you don't even know how many residents in remote areas, you don't have the number 20,000, just shifting that 200 trained health workers are now delivering regular care in a particular remote area, which did not happen beforehand, is still a very powerful way of reframing into, from features, we train 200 community health workers, to benefits, so what? what change in the community. So that's one of the ways to start thinking about your own impact storytelling, is how do you kind of flip it to from what we did to what change. Next slide, please. Okay, so, and here we get to test which one of these statements is focused on a benefit. So which one is benefit rather than feature? So first one is it we trained 200 young people on business skills? 70% of young people trained by our program started their own business within 6 months. Our program aims to reduce unemployment in the community. We delivered 3 workshops in June. Which one of these statements is focused on benefit? I think we've got a clear winner here. That 70% of young people trained by our program started their own business within 6 months. So I think we're getting an idea of how do we kind of, giving you some examples of how do we flip, how do we kind of tell our stories better. If we could go back to the main slides, Deepika, that would be great. Okay. So we go back to, sorry about that. So I'm now interested, so I've told you this example of benefits versus features. Now I'm interested to hear from everybody in this virtual space, virtual room. How have you been capturing impact of your organization? So how do you currently capture impact? We've got interview clients, survey, long reports, community voices, documenting activities, focus group discussions, impact evaluation, using the database, using data interviews, stories, you can see a thing. Henry, we capture impact by assessing the benefit the program has brought to people, surveys, and questions to people. Excellent, Henry. Thank you for sharing. We'll wait for... So what we're gonna, and it's great to see this, there's been quite a nice range of things that people did. Community entertainment. Jacopo says, I like the one on stories. I'm more curious about community entertainment. And there's FGDS. How, the person who's put down community entertainment, would you mind telling us? Because I think you've piqued a lot of people's interest now.
Hello.
Hello, go ahead.
Yeah, sorry. I think that was just a little bit of an error. It's community engagement.
Okay. Thanks, Patience. Yeah. Louise says we also involve communities like volunteers to capture results through sharing reports, capturing data using tablets. Abenakyu says we conduct review and planning meetings with the stakeholders. Excellent. So it sounds like a really rich does anyone want to come off mute to talk a bit about how they're capturing impact? The most important is community engagement, interface meeting, and use of community-led monitoring. Louis, would you mind talking a bit about community-led monitoring? Because I think that's something new for some of us here. Okay, maybe the mic is not working. So this is great to see how these different ways that people have for...
Hello.
Hello. Hello.
Sorry, I had a problem with my mic. Let me. Okay.
Yeah.
On community monitoring, I think what we are doing is like, for example, we have a program that we're implementing here that is being funded by Global Fund, and normally we go to the community where we have groups of people. They identify their problems or like have a problem that they have, and then they do the priorities. Then we give them assignment to work around. The community also try on their own instead of waiting for funding. They do their part using the stakeholders within the district or within the community, and they try maybe, for example, if they have a problem with the infrastructure, they can try maybe to mobilize resources and construct that one. And maybe so what we do, we have like indicators that even the community on their own, they check. They had no, if in the past they didn't have that infrastructure. What was the challenge? Now they have infrastructure. What the challenge? Numbers of people accessing the services that they facility, or how many people accessing this facility from there? Or maybe we are running from like number of defaulters from the system. So using that, I think on their own we have we have like scorecard committees, and then they do the scoring, and then they come up with the data, and then on their own they understand the challenge using even the data, using the other things, and then they report to us. So that's the way we do it. It's a concept that, but I'm just summarizing it in a simple term, like the way I'm explaining it. Thank you.
Thank you so much. I think
Can I come in also on community-led monitoring, how we have been using it in Zambia? You design a tool, then you focus on the community beneficiaries of the services, where you ask them on how the services have been delivered to them. Then they share their experiences, their challenges, and the feedback on how to improve them. This is a good tool that also allows the beneficiaries to respond to the services that have been receiving, especially with the people who has not been even involved in the service delivery, because sometimes it becomes bias when you are offering the service and also asking the communities to give feedback, because they will always want to give you what you have been doing to them. But if you use different people, it helps to capture the exact reaction of the people. So even in Zambia, we have been using the community-led monitoring initiative to assess. And sometimes when you do this tool, maybe you focus to interview about 100 people, then it disaggregates and gives you the dashboard on how best you need also to improve on the services. Sometimes you would think you are providing good services to people, but at the end of the day, it's not as good as you might be expecting. So this feedback is important in also to ensure that what is given to the people is the real thing that you want. And sometimes you also realize that maybe you have engaged people that have got no experience in service delivery. So it also helps you to improve. For the community-led initiative, it improves the service delivery and how you want to achieve your results at the end of the day. Thank you.
Thank you, Henry. And no, thank you. No, this is I can see some comments coming. No, thank you so much for sharing that, because that's a really interesting model where, and I think it's also one that's very, the communities are showing agency in the sense that they're leading the monitoring, they're leading the evaluating, they're leading the whether these services are as good as they should be. And I think we've got that a couple of comments from, sorry, Louis, I think, I don't know what is going community-led monitoring can be used in any project in the community. It empowers the community and it strengthens community engagement and involvement. No, definitely. I think, thank you to both of you, because I think that's a really powerful way of where the community has agency and dignity, and it can be a very powerful way for impact reporting use data from this kind of monitoring. Deepika, if we could go back to the main slides. So it's been great listening to what everyone's been saying, and I'm really interested in, especially in the community-led monitoring, because it kind of fits in really well for what I always like to leave people with something useful. And one of the things is this impact statement formula. So it's one of the ways to make it much easier for all of us, because sometimes it might be like, oh, yep, you've told us all these things, but how do we do this? What is an easy way to do it? And one of the ways is to kind of think in terms of this formula. It's a very formulaic way, but it does help us kind of think through how do we do impact reporting. And I think just listening about, like, when we've got data from interviews, from community engagements, from community-led monitoring, from surveys, focus groups, how do we kind of translate all that into an impact statement? And we kind of have to think in terms of the target group. Who is the target group? Who exactly did we work with? Experience a positive change. What is the change that occurred? Generally, we went positive. You could talk about negative changes if that has happened. Through the organization activity, what did we do? So as I said, we're not the hero of the story. We're not the main character. So through the organization activity, and then evidence by data or story. Next slide, Deepika. What does that look like? So I've got two examples here. So target group, in this case, is thinking in terms of rural families is our target group. That was who we were working with. What was a positive change? Reduce household smoke exposure. I like numbers. I'm guilty of it, by 60% kind of thing. You don't need the numbers, but through the organization activity, what is the thing we did? So it could be what the organization had done was provide clean cooking stoves. So through access to clean cooking stoves. So that is what the organization activity was. And the evidence is by air quality monitoring and interviews with women in the community. So this is a way you can start building your impact stories. The second example, young people in X district gained, so that's our target group, young people in X district. They gained skills to start small businesses. That's the positive change. And what did the organization do? We ran entrepreneurship workshops. And what is the evidence to tell us this is 70% of them launched income generating activities within 6 months. So this is, I find it's a very quick way to kind of do, like, using that formula in a way to think in terms of how do you flip, how do you do impact storytelling much quicker using this kind of formula. And now we get to practice. Next slide, please. We get to practice what this looks like. So I have made up a terrible example here on purpose. So we provided health services to poor rural people who have no access to proper care. So we've started with this. Next slide. So thinking of 4 guiding questions. Who is the target group? What positive change did they experience? What did your organization do? What evidence can support this? And next slide. And now apply the formula. So I'll give people a few, maybe 30 seconds. And if you want to put your answer in the chat box, how would you can make things up, because I clearly have not given enough information. So make up the positive change or and if you've come up with a statement, just pop it in the chat box. The reference questions right at the top. We provided health services to poor rural people who have no access to proper care. And then applying the formula. But the 4 questions is a useful way in terms of thinking before we apply the formula. Any takers? Okay, it is a very hard task kind of thing. We can go to the next slide, Deepika. I feel like one of those cooking show hosts where I've got something prepared kind of thing that from the oven. So what way of applying the formula would be, who is our target group? And as I said, we shouldn't use language, poor rural people. It's a bit, we can be more specific, because we can be a bit more specific. Sorry, I think too many things happening. We can be a bit more specific. For instance, older adults in remote communities. So always think of your target group. What did we do? We did regular home visits from trained health workers. What was a positive change? And that's, you always have that first in terms of they experience better management of chronic conditions. And then what is our evidence? So you could, if you've got data, and if you've worked with, and I think that's what our next session would be about, if you're working with a research institute, they can help you gather some of this data in terms of reducing hospital admissions, or it could also be positive feedback from community health surveys. So it's starting to get you to think in terms of, when you're doing your impact storytelling, is how do we move from going from the reporting on just activity, we provided health services, to what was the result of that? Who was the target group? What was the change? And the change was that a certain group of the target group, or older adults in remote communities, experience better management of chronic conditions. So really starting to flip the way we talk about impact storytelling kind of thing. So just starting to give you some, and I think someone mentioned something about slides. I just saw it pop up in the chat box. Yes, they will be provided. But I think it's a very useful way every time you do, and look at some of your own reports, to kind of think in terms of what it means to think of who benefits, what has changed. So I think in the interest of time, I just had a quick look at the time. Happy to, I think, finish off. I think this was more of, I think we'll skip this activity because I've just realized what time it is. And just kind of finishing it up in terms of thinking, what is ethical impact storytelling? And I think it is, we've spent time in unpacking language, challenging default narratives, and thinking more deeply about how we tell stories of impact for both funders and reports, but not only for them, but in ways that honor the people and communities at the heart of our work. And it isn't about polishing the perfect success story. I think it's about shifting power and showing change and making room for agency and not just need. And I think, if anything, one of the ways I want to end my bit is, and before we move to the second session, is what would it look like if your stories, your impact stories, didn't just describe activity and what your organization does? You're not the hero, you're not the main character, your organization's not the main character, but captured the change that really matters. And in terms of shifting, the main character is the community. And thinking in terms of impact stories that affirm dignity, impact stories that build trust, impact stories that create space for the voices that matter most. Because I truly think that the way we tell our stories is also part of the impact. So that is, if there are any, I think that's the end of my session. I want to hand it over to Deepika so she's got plenty of time for her session. We're doing questions now, or we're doing questions at the end? I will leave it to the coordinators, Deepika and Yakubu. Which way do you want to do it?
If there are any quick questions, I think we can take it and then move to the next segment. We do have a section towards the end where we would like to hear from you all on your reflections on this workshop and learnings. But if there's anything urgent that you would like to ask or share, we can take a minute or two.
Yes,
Just a quick.
may I think we are grateful for Abia for the presentation. And, you know, one of the most important things, especially when you talk about the impact and the sharing, it is also one of the most important things that keeps the organization moving forward. Because we believe anything that we are doing shapes our organization in moving forward. And without the impact, then why do we exist? I think that is one question that we ask ourselves as Vision Outreach Zambia. Because without impact on whatever that you are doing, then you are wasting the resources that is hardly earned by the donor who is giving you. So we look at these issues as the most key factors in improving the health lives. Because we believe when you are doing any activity, you want to produce results. But then the results, how are the people going to accept your results? Are you investing really in what you want to achieve? Or are you just focusing on resources that other people have given you to produce results? So the most important thing as Vision Outreach Zambia that we have been focusing on is to produce what people will talk about even after the funding has ended, and that is part of sustainability. When we talk about impact, we are looking at also at sustainability. How are the people going to move forward even after the project? Is it that once you finish the project and your funding is gone, then people stop talking about it? But what is it that you are going to produce that people will always look for and implement even without the funding that you have gotten from the donors? I think that is the most important about the impact. And you have helped change the lives of the people going forward. I think as Vision Outreach Zambia, that is our focus and our niche to keep us going, because at every moment you need to look at the people, because any service that you bring has to have impact on the people, and the people should change. And when you involve them at every stage, from the design, implementation, and the monitoring, the impact is felt by everyone in the community and beyond. And that's how, even as NGOs, we focus on these issues in order to leverage. That's why we are there to support what government is doing, but in a more effective and sustainable way. Thank you so much.
Thank you so much, Henry, for those reflections. Shweta?
Hey, hi. Echoing the sentiments of gratitude and obviously great presentation. Thank you. I just had one reflection, kind of tying in with the previous comments, is the deep frustration that we all feel, and I've kind of been on the other side in the grassroots and sort of very difficult settings, is this lasting change beyond the life of the grant. And I wondered if in your formula of impact, there may be space to consider adding the word positive lasting change, because the positive change is often well articulated in some format or the other. Perhaps, you know, there's definitely room and scope for improvement to the benefits, but it's the lasting piece that leaves with a degree of sadness, considering the quantum of funding that often is upfronted by many of these projects vis-a-vis the economy of these of the communities, and that, from my work, really creates a big distance between communities and researchers and organizations, because yeah, it just feels like, hey, can you just stop doing the work and just give us a little bit of that so that we can just keep things lasting. So I wanted to advocate for that piece.
Thanks, Shweta. Thanks, Henry. And I just, Jacobi, you had your hand up? I noticed.
Yeah, Rabia, I really must thank Shweta and Henry for their contributions there. I also worry that many times when we are very much focused on outputs and documenting those outputs, there is a way that it can take our focus from relationships and people. And I see that, you know, recognizing the impact that your program is making, alongside ensuring that you're keeping an eye on relationships, is just ensuring that you're not becoming transactional. And I just wanted to throw that bit in around, you know, how an eye on the results and then an eye on relationships, where it needs to go hand in hand.
Thanks, Jacobu. No, thanks, Henry, Shweta, and Jacobu. I think I'm really insightful reflections. And I think it also gave me a lot of, provoked a lot of thought and thinking myself in terms of, how do we kind of, in this impact reporting is think in terms of relationships, but also the long-term sustainability and the outcomes, and things like that, and how do we kind of incorporate it? And I think a lot of it is happens through this. I mean, I do not have all the answers, but I think what it does is it kind of makes us think, and maybe with the little impact formula, might have to do a version 2, where we do talk about those things and making sure that that's the headline, but below that we start thinking about the relationships we built with community and stakeholders, but also making it less transactional and more sustainable kind of thing. So I think a lot of it was very thought-provoking. So thank you, the three of you. Very conscious of the time, so I will hand it over to Deepika, or I could talk forever.
Thank you. Thank you so much, Rabia. And thank you to all of you, for such an engaging and reflective discussion. I wish I could, we had plenty of time and we could just sit and reflect. This could go on and on. So being mindful of the time and moving on to the next segment, where we are taking the conversation towards experience of taking the work and its impact to scale, we begin with another interesting question. So I request you to go back to your Menti meter. This situation is that imagine that you're documenting the impact story of your organization's involvement in a project that has served nearly 1,500 people, with numbers steadily increasing over 10 years. So with this context in mind, if you have to think through what challenges you might encounter in capturing and telling your story, I request you to please go back to the mentee and share your thoughts. I'll repeat again the situation.
Could you share that QR code again? I got out of Mentee, so I don't know how to get back in.
Yes. Here you go. 6697-6553.
Share again the QR code.
I've just written the number in the chat, Henry, if you want to look at it.
Okay. Sorry, I'm a bit lost. Yeah. So this situation is, imagine you are documenting the impact story of your organization's involvement in a project that has served 1,500 people, with numbers steadily increasing over 10 years. So if that in that situation, if you have to capture and tell your story, what are the challenges that you think you might encounter? So I see resource constraints, skills, time to write, collecting accurate data, data capturing tools, cultural sensitivity, interesting, poor research skills. Positive change beyond number. Thank you. Anybody who would like to unmute and share? Cultural sensitivity is interesting. How, if you could help us understand a bit more in terms of how would that be a challenge?
Maybe let me share.
Sure, Henry.
Yeah, when you talk about culture, you are talking about the people's way of life. Culture, like in Zambia, you have different cultures that hinders on people's acceptance to service delivery, especially when you look at traditional beliefs that borders on culture. Maybe my language could be a Bemba. What are some of the culture beliefs that the Bembas want? Maybe in terms of how do people deliver services? Is it culturally sensitive? And if it's not culturally sensitive, when you get into a community, maybe you dress in a way that certain culture does not understand your dressing code, people won't accept any delivery of the message that probably want to deliver. Say for instance, a woman gets into a community dressed in a mini dress, and how is culture? How is that going to hinder people getting what this person is trying to give to them? The dressing code also has got a bearing on our culture in our country. If you don't have a wrapper with you, people won't take your message so serious, and probably you are wasting their time. Also, the language that you produce, is it culturally sensitive? Are people going to get your language based on the message that you want to produce? There are certain times that probably your language will determine how people will react to your message. And at the end of the day, they will accept or refuse to accept what you are delivering. You might have the valid points that you want to give to the community, but the way the language you portray to the people might not understand you, irrespective of how best your message is. And also the age limitation. And that's why sometimes there are certain messages that are based on the age limitation. That's why we call it peer. If I go to an elderly person and then talk about certain things that my age and the elderly person are different, how are the people going to accept you? I think those are part of the culture sensitive issues that we look at.
Thank
So
you.
that even when you want to involve people, involve them based on their age category and also the language and also the dress code. I think these are paramount to delivering the impact that we want to see in the community happening. I think I wanted just to share those issues.
Thank you. Thank you so much, Henry. And I see a couple of comments in the chat as well. From Louis, volunteers sometimes may increase in number or achievement while on ground is not true reflection. Sometimes people are not open to sharing true reflections, political interference or policies. Also, I think reflecting on so many of your inputs on this question around challenges, I see that is a space where we see potential collaboration with a research institute could help bridge these gaps in terms of, for example, research skills, collecting data capturing tools, having the skills and resources where that partnership could help us bring in those skill sets to help capture that. I'll quickly check, Sujoy, if you are with us. Hi, Sujoy. Can you hear me? So we had the next segment where we wanted to build on the challenges that you have shared with us. Quick fireside chat with Sujoy, who is the National Advocacy Officer from Child and Need Institute, and George Institute and CINI have collaborated around child drowning in an eastern state called West Bengal in India. He's traveling, I'm aware, but I think I can't see him in the participant list. So maybe we move to opening up some reflections around how do you see potentially, addressing these challenges could be done through collaboration with research institutions. If you have had previous experiences like these around collaboration, or if you have attempted to address these challenges, what has been your experience? And I see, Yakubu, you have raised hand.
Yeah, thanks, Deepika. I just wanted to invite Louis I was reading Louis's question where he said, how are we going to transfer this knowledge? And I wondered whether you wanted to speak more, Louis, to that as a challenge. And maybe we could reflect a bit more together around the challenges that we face in this area.
Hello?
Yes, Louis.
Okay. Yeah, so just wait a little bit. I'm three computers. Okay. I hope you can hear me now.
Yes, we can
Hello?
hear you, Louis.
Yeah, sure. So
We
I
can
was
hear
talking
you.
about I was talking about the challenge that normally you have like in the community. Normally when we do like implementation of activities like maybe of giving them an authority to collect data, sometimes because they understand what we want to achieve, and then instead of doing the right thing, they can give us fake information. And of course, we normally understood when we were doing the validation. So you see that there's this challenge. But now because we're transferring the capacity and the skills to the community, we want to trust them. And when they're giving us false results, I think it also affect the true reflection of the results that we wanted to achieve through the project or maybe or a study or the research. So that's another problem. And even when the political interference, sometimes like in countries like, for example, here in Africa, when those disasters, they're going to reflect like a bad side of what is happening in the government, maybe what is happening with the political situation. Then if those people, when they want to come up with the disaster, they'll say, no, don't say anything about this. Even the community, they do have like that policy that the community, maybe the chiefs can say, don't give this disaster. So it's sometimes difficult to capture the real disaster or the impact of the activity that we are implementing, maybe of the study. So yeah, I think that's a gap that I've seen, and maybe you also explained about maybe there's need for maybe proper training, monitoring, and other things. I think collaboration with the community, because this is more of the community engagement. So those are some of the challenges that you normally face. Sure.
Thanks a lot, Louis. I think at the center of that is this issue around, I guess what I'm hearing from you is how can we be sure that what we're capturing is the right thing? And Deepika, I don't know if it's okay to invite Rabia's reflection on that.
Yes.
Like, yeah, and I see there are a few hands up, but Rabia, if you wanted to just, share a quick reflection on those challenges.
Yeah, no, I think those are really interesting challenges in terms of about that, what do we measure and whether they're the right things and things like that. And I think it comes down to there are two ways I think of thinking of them. What first is when you first started the program, what were your intentions? I think sometimes it's about the intentions, and sometimes it can be just about the funders, whatever the funders funded people for in terms of the changes. But the other way to think is sometimes is, and there are a couple of techniques that are becoming much more used more often, things like more significant change technique or outcome harvesting, where what that is about is that some things have gone well, some things haven't, some things community cares about, something funders care about. So you use these techniques to kind of understand what was the change as a result of your program. So you don't predetermine your results, but instead you kind of think in terms of, and then the techniques, which I can put them in the chat box, which help you to kind of identify those changes from all the stakeholders. So it could be the community, it could be the service providers, it could be funders. So it's a very different, newer way. But it's been maybe the last 10 years or so, where you don't know what the change is going to be, or you're not sure what the change is going to be. So, and I'm happy to put that in the chat box, those two techniques.
Awesome. Yeah, we really appreciate that, Rabia. We'll just get responses. Shweta, you want to go next?
Sure. Yeah, I just was reflecting and wondering from colleagues working in civil society have we reached a point where there is some of the research is actually probably a hindrance or a barrier, or in fact having a negative impact on communities, given that there is a palpable gap between research for the purpose of research and then the sustainable impacts and outcomes that the communities are left with. And do they perceive this gap to be so wide? And do we need to, I just wanted to kind of like ask that question from the group, following on the previous colleagues' comments.
Yeah, Shweta, that's such an important question, and I'm happy to see Gordon's here online, and if she gives me the permission, I hope, Gordon, you don't mind us telling this story about our interactions with you, which I think, responds to your comments, Shweta. I do agree with you that when we were speaking with Gordon's earlier this year, one of the things that she reflected with us was that there's such a huge gap between what we're doing as researchers and what community folks want. And just like you've mentioned, Shweta, a lot of that gets in the way, that not everything is research. Some things are just activities that already communities have the systems to lead by themselves or want us to come and tag along. And it's not about another research output per se. And one of the things that I remember reflecting with Gordon's was what she said. A number of times it's really about, us coming to tag along, but not getting in the way, with our agenda, and just sort of being able to listen and understand what are the activities that communities are already leading by themselves, and just need that support, whether it's in terms of connections to the right voices or whether it's in terms of links to the right, resources. But I see their other hands, and I wonder whether they will have more reflections to share on Shweta's question and reflection, which is research really getting in the way of change in communities? If I'm putting it that way, well, Shweta. Patience, you have reflections to share on this?
Thank you, Yakubu. I just want to, for us in Nigeria, an organization that works in the area of women and girls with disabilities, is difficult for us in the area of getting intersectional issues around reporting. And it's difficult because in Nigeria, we are still, it's still kind of new around the concept on intersection. And so people don't really they don't even know what it means. And if they are trying to understand what that word or that concept means, it's a new word. So we do not really have reflections around how to capture intersections in our work. And that is one area that our organization, Advocacy for Women with Disabilities, also trying to bring to the table to say, look, as CSO, especially focusing on women and girls with disability, a community that is hugely marginalized and actually not on the priority list of many of the stakeholders, especially within the government, it is difficult, really, really difficult to actually bring the word intersection, how it reflects to our work, how it connects with the government to the table. Yeah, but one good thing is that people are beginning to buy into it, but we still have a bit of an issue in how to report, how to capture intersectionality, because this for us as a community of persons with disability or organization of women with disability, we actually make a huge impact or difference in our work, bringing the intersectionality and the factors linking to this into the table. So reflecting on what we are doing today, I think it has also given us an idea to say, okay, thank you, Rubia, for really sharing how to bring our, to tell our stories, and linking that to intersectional reporting, and also to sell this idea to our funders, and also help us to also think around sustainability in the area of bringing intersection to the center stage. So for me, I would say that
sorry,
we'll
Patience, I may need to come in there. So we're just on time, and we wanted to just get feedback. But thank you, Patience. I mean, you've made a strong argument for intersectional reporting. And if it's okay with us, we're just on time, and we didn't want to end without getting your feedback. So Deepika, can I get your support on sharing the code again? And we just want to get your feedback on what one thing you'll have gotten from this sessions. You've listened to Rabia share, you've heard from different people share their thoughts. What is one thing that you have learned today, that you're taking away with you today? And if you could just put maybe one word, it will be important for us to know what stuck with you, what resonated with you, that you will take back with you today to your work. Yeah, I see language of dignity. Robbie, I really liked your invitation for us to focus on people's dignity and hold their needs alongside, strengths. That one really stuck with me, Rabia. There's something about hearing that is saying, oh, but you're not going to get funding. You're not going to get funding. But I guess that's not true. I think you've made a strong point, Rabia, that the things that people want to see is change. And if you can demonstrate that change has happened, so that also stuck with me. I can see how to conduct impact assessments. That's also good. Maybe one more. Is there something that has stuck with you from today? If you even wanted to write it in the chat, sharing the significant change technique. Thanks, Louis. That's helpful. We'll move on to the next question in the interest of time. Will you be able to apply this new learning to your work? What Rabia has shared with us around, yes, okay. Somebody says not sure. Gordon, I see what you've said about language matter. It does matter. It really does matter, the language we use. Absolutely. So there's a bit of uncertainty, not sure. We're having a predominant yes. And maybe we go to the next question. And it's important for us to know what additional support you will need to capture and share your organizational impact. So what do we need? What do you think you need? I see, yes, you have heard something today, but you can see we've done a quick tour de force of the subject, and we have barely touched it as we should. But in terms of getting additional support, to be able to, implement everything we've learned today, what more do you think you would need for yourself and your organization? So more workshops like this. Okay. Are there things that you think we should target in the next workshop? If you can't write it in the Mentimeter, you can write it in the charts. And I see, Henry, you have shared that you need more capacity building going forward. So we think that there's an appetite for this. Thankfully, these are the sort of things, organizational capacity. And so I think there's really a theme here around more capacity building that is being needed, and more workshops. Okay, collaborating with the George Institute. And I think, yeah, that's really our last question to ask you. We're not doing this alone. We actually do boast not just of our strengths, but collaborating with people like Rabia, who also work, outside of our organization. And so our last question, if we can go to the last question, is how might a partnership with the George Institute, and of course, we're going to draw from strengths within us and outside of what we have, but how might a partnership with the George Institute. We're a medical research institute with offices across the UK, India, China, and in Australia, and we really pride ourselves with the partnerships we're building across, African countries. So how might a partnership with the George Institute support your interest in recognizing, documenting, and sharing the impact of your organization? And if you could just, click one thing that you think, working with us might help you do better. But we also want to learn from you. So we think that there's a way partnering with you will benefit us as well. Yeah, we could select more than one. Yes, Ndeke, you can type any other thing you think of in the chat. If you think of something else that is not there in the options, you can type it in the chat as well. So I see there's quite an appetite for applying for a grant together. Thank you, Shweta. Really, really appreciate you for joining in. And we'll just go to the last slide, Deepika, just so that people can have Rabia's email as well if they want to reach and follow Rabia's work. Rabia is very active on LinkedIn, and she shares awesome resources about building surveys that matter. And she shares them in series, part 1, part 2. So please look for Rabia on LinkedIn. Or if you want to write her via email, I'll really encourage you to get in contact with Rabia. And Deepika and myself, we lead the Ubuntu Initiative at the George Institute, and we have our emails here. And so Patience, Louis, and every other person else that I've said, you want to write grants together, we're really happy for us to reach out to us. Gordons, I see your comments. You have our emails. Please reach out to us. Part of what I've learned today is really working in partnerships. There are things that we believe we will need to learn from you, and we would like you to write us and let us know. And again, please feel free to write Rabia directly and do let her know how this workshop has really, stirred a lot of interest for you. In the interest of time, we really will have to close the meeting. We're sort of 8 minutes over. But it's really been a pleasure to really talk with you, Rabia. Thank you so much for being very generous with your time. And it's really good, Deepika. Thank you so much for such great facilitating. And it's a pity we couldn't get to hear from Sujoy, but we will share a bit more about, the work of Sini as we share the email responses. But have a great day, everyone. And please write to us and let us know how you're doing. Yeah.
Thank you so much, Yakubu and team. We are grateful.
Yeah.
Thank you.
No worries.
Thank you. Thank you, everyone.